I'd like to use this opportunity today to explain how this legislation came to be and why I believe it's so important at this critical juncture. First, my wife Jenny and I have 4 young children of our own. And as a parent, I know I speak for millions when I say that every child deserves to grow up in a stable, loving home. When the bond between parent and child is broken and children can't safely return home, they deserve to be placed in the setting that's best for them, regardless of whether that home's within their state or across a state line. However, due to various factors, children are languishing in the child welfare system, waiting to be placed with an adoptive family, a relative, or foster parents in another state. Now, one reason this is happening is that today, in order to place a child with a grandparent across a state line, caseworkers must literally print out hundreds of pages of paperwork, package it up, and mail case files to another state. The receiving state responds in kind, completing their portion, and then mailing the case file back. It's an antiquated process that, on average, takes more than 100 days to complete. At a time when communities, courts, and caseworkers across the country are already overwhelmed, this inefficient paper-based placement system is simply unacceptable. Now, few dispute that a dramatic spike in the number of children in need of placement has sadly coincided with a nationwide drug epidemic, an epidemic health officials describe as perhaps the worst in our nation's history. For decades, we've made steady progress, and the number of children in need of out-of-home care was actually decreasing. Yet the trend, unfortunately, has reversed. When dedicated caseworkers and longtime child care professionals in my home state of Indiana describe the current environment, they characterize the increase of parental drug abuse as having had the most detrimental effect to the child welfare system they have ever seen. While elected officials at all levels of government come together to address this nationwide opioid epidemic, we can't lose sight of the children who have been impacted. And if you listen to the professionals, as I have, or visit with families who've opened their hearts to these children, as I've also done, the stories they tell are harrowing. I heard the story of a 2-year-old boy left abandoned in a hotel room. Staff found the boy alone, only God knows after how long. When he arrived on the doorstep of a temporary foster home, he was barefoot, he had no shoes, no belongings, save a few pair of socks wadded up in a plastic bag. For children who've endured such unimaginable circumstances, and there are many, the sooner we get them placed into a forever home, the better. I say this as someone with experience. Before entering Congress, I provided pro bono legal services for adoptive couples. These situations can be extremely hard on all parties, but none more so than the child. And you don't just have to take my word for it. Statistics show that the longer a child remains in the child welfare system, the less likely they are to have successful outcomes later in life. When proven interventions that can help these children present themselves, I believe it's our moral imperative to act. It's this belief that led to the solution we're discussing here today. The Modernizing the Interstate Placement of Children in Foster Care Act would incentivize states to connect to an electronic interstate case processing system that has been tested in a handful of states, including Indiana and Washington, D.C. These are pilot programs that have achieved substantial reductions in the time it took to place these children into homes, reducing the time a child has to wait by roughly 30%. And for a child, that means a month and a half less time being shuffled from foster home to foster home, being taken in and out of school without a set routine. In one pilot scenario, Indiana had an emergency request to place a child with a relative in Florida. Use of this system allowed both pilot states to exchange their case information the very same day, which, under the current system, could have taken weeks. We can expect to see more of these positive results as this electronic system is expanded. So this bipartisan, bicameral bill was developed through a year-long process, consulting with key stakeholders to make sure there would be broad support. And I want to thank those stakeholders, as well as my colleague, Congressman Davis, for his leadership and support on this bill. I hope we can all agree today that we should do everything possible to get our most vulnerable children immediately placed in the setting that's best for them, regardless of state boundary lines. I urge my colleagues' support, and I yield back.